So again, in this video, I'm discussing recall communications. The task was talk to the mother of a 14-hour-old boy who had recently discovered that her own dad is 84 years old, has Huntington disease. Okay, she wanted to test done for her newborn baby. I asked that she knew about the illness. Also found that she has not checked if she herself had the disease. She wanted to do the test just for the sake of the knowing. I briefly explained to her about the disease, the mode of inheritance. The bulk of the discussion was centered on the fact that the test was not relevant at this point. He would find it very difficult to get a life insurance, etc. Mom did not sound to be convinced. I politely but firmly stood my ground. So the task is actually mainly a newborn baby's grandfather has Huntington disease, and newborn baby's mother wants to know that the newborn baby has this disease or not, because it is an autosomal dominant conditions. But we don't allow the investigations. It is not we will do. Now we have to convince her. So as usual, we are starting IRCAP, introducing myself, making a report, taking the constant, clarifying my rule, agenda, attendance, and prior knowledge. Mrs. Salma, how can I help you? My father was diagnosed last month with Huntington disease, and I did not from where he got it. Did not. Okay, it is getting very worse, very quickly. It is killed him, doctor. He forgot how to use the toilet. The gene doctor told us that disease runs in genes, and I am really worried that my child have it, and that is why I am here. And I need to do some genes test for him to know whatever he have it or not. Okay. So I'm really understanding how do you feel. I'm so sorry for your dad. I'm so sorry for what you are passing through, but I'm really sorry. We cannot offer this test for Adam. So when mother is telling that his dad is her dad has Huntington disease and he suffered this problem, so she wants to know her child has this disease or not. Then we tell that I'm really sorry for your dad. I'm really sorry what you are passing through, but I'm to tell you that we can't. I'm so sorry to tell you that we cannot offer this test to this newborn Adam. Why, doctor? Mother is asking. Because actually it's Adam condition. When he grows up, he's the one to decide whether he wants to do it or not. So why? Because it is totally Adam's conditions, and only he is the person who will decide whether we want to do the test or not. When he's grown up, we'll do his opinion. Okay, he's just 5 days. Doctor, he cannot make such decision. I understand, and that is why we cannot do this test, because as I have mentioned, it is his decision. It is better to wait till he grows up and understand all about this disease and about these decisions, and he is the only one to take these decisions. The mother is telling she is only a newborn baby. How can she has given the opinion? The answer is that I understand. I know that he is the newborn baby, so that's why we can't take the test right now. Can't. We have to wait until he's grown up. He will know about the disease. Then he is the one who will take the decisions. He wants to do the test or not. Okay. Why you do not do it now? Because why? Imagine with me what kind of life Adam will gonna live if he waited whole of the life for these conditions. Can imagine with me? Do you think he will be able to enjoy his life? Do you think he will be able to go to school, learn? Imagine waiting for the life for a disease will kill him. A disease kill you. I'm really sorry to tell you that. So why you are not doing or offering this test? Because um, uh, if he knows that he has a disease in his body, he will be wait for this disease. Imagine what type of life he will be deal. He can't go to school or learn new things. What type of life he will deal. So it is better we can't do the test. Okay, doctor, I'll not tell him. Actually, we cannot hide this information from him. I mean, once you know, then he has to know. So mother is telling she will hide this information. The answer is that actually we cannot hide this information from him, because once you know, then he needs to be know this informations. What are you talking about, doctor? I am his mom and I have the parents' right. Yes, you are his mom and we are totally respect that. But in the issue, Adam has to make his own decisions by himself. The mother is telling that I am the mom. I have to take the decisions. We are told that yes, you are the mom and we totally respect you. But this is in this case, it is Adam's condition and Adam's have to take the decisions. Okay, doctor. If you will not to do this, I will complain. I can understand how it is difficult time for you, but actually if you complain, the court will not do Adom decision. So I understand that you feel like that it is really difficult for you, but actually if you complain, then also the court will not decide anything. So, doctor, what should we do? If you are inviting to know the odd, we can do the test for you. And if you have the gene, then it means that Adam has 50% chance of having the disease. If you do not have the gene, then Adam will not get the disease. So, mother is again forced in. Then we tell that if you tell us, then we can take your test. We need to know that you are suffering Huntington disease or not. If you have the disease, then that is a 50% chance that Adam has the disease. If you have not the disease, then there is a very less chance of Adam. No, I do not wanna know whether I have this disease or not. I wanna enjoy my life. The same rule will be applicable for Adam, and it is his right to decide whether he would like to know or not. His right to enjoy his life. So mother is telling, I have the right to enjoy the life. I can't do the test. So also we tell that same rules applicable for the Adam. He is also the one who can enjoy the life, and he is the one who has the right to take the decision he want to do the test or not. So this is all about Huntington disease communications. Recall Huntington disease is an autosomal dominant condition. Thank you very much.